Good afternoon, everybody. I'm sorry for our late start. We were having a bit of technical difficulties. My name is Vaughn Edelson. I'm Assistant Director of Health Communications at Genetic Alliance. Thank you for joining us this afternoon for our webinar, Children and Youth with Special Healthcare Needs in Healthy People 2020, a Consumer Perspective. Today we have Bonnie Strickland and Diana Demboba from the Maternal and Child Health Bureau, who will be giving us an introduction to healthy people as well as their Envision 2020 strategic plan for their division. And then Trish Thomas from Family Voices and I will be discussing the consumer perspective document that we worked together to put together, going over children and youth with special healthcare needs in Healthy People 2020. So pretty self-explanatory title. So without further ado, I will pass it over to Bonnie Strickland. One quick reminder before we get started. If you have a question, please type it in to the panel on the right-hand side of your screen, and we'll take those questions as they come. All of the participants are in listen-only mode.
Hello, everybody, and welcome. Sorry for that technical glitch. As I thought I was saying, to my knowledge, the report that's been developed by the Genetic Alliance and the Family Voices is the first review to reflect the views of families regarding the objectives from the Healthy People 2020 as they relate to children and youth with special health care needs and their families. So we're very, very excited about this. Many of you are familiar with the systems framework for children and youth with special health care needs, which guides the work of the Maternal and Child Health Bureau and our division. But you might be less familiar with the relevant Healthy People 2020 objectives that align with this framework. MCH has long been working on systems of services for children with special health care needs. But in 1989, with the Omnibus Budget Reconciliation Act, legislation established the requirement for HRSA to actually facilitate a system of services for children and youth with special health care needs. As visionary as that legislation was, it didn't define that system of services, and it didn't define children with special health care needs. So we spent several years of development to define the population and the system. And ultimately, we developed the National Survey of Children with Special Health Care Needs that became the tool to establish prevalence of children with special health care needs and to monitor progress. That survey, interestingly enough, made it possible for us to ultimately begin to have objectives in the Healthy People 2020 and actually its predecessor, Healthy People 2010. So for those of you who aren't familiar with the definition of children with special health care needs, it's here. It's children with special health care needs are those children who have or are at increased risk for a chronic physical, developmental, behavioral, or emotional condition, and who also require health and related services of a type or amount beyond that required for children generally. And this definition was published in Pediatrics in 1998, and it's one of the broadest definitions in government, certainly, and it's designed to bring us to everyone else's table. So that's why it's intentionally broad. So that's the definition that we're really thinking about when we move toward trying to get objectives into the Healthy People 2020 and its predecessor, Healthy People 2010. Interestingly enough, the objective that you see right now on your screen, it was the very first objective that we were able to get into the Healthy People objectives related to this population of children and families, and we're fortunate that, in fact, this objective still remains in the newest edition, Healthy People 2020. Next slide. As we move forward, we work closely with families, professional organizations, state programs, and researchers to refine the core elements of a well-functioning system of service for children and youth with special health care needs. We organized our program around these 6 elements, and we developed a monitoring strategy through the National Survey of Children with Special Health Care Needs. So here you can see our six systems elements are partnerships with families and youth, access to care through the medical home, adequate financing, early and continuous screening, organization of services for easy use, and transition to adult health care. Next slide. All of these elements work together as a broad framework for all of the programs in our division, and you can see the programs that we support in the inner circle: autism, epilepsy, TBI, hemophilia, sickle cell, and thalassemia. And those 6 systems elements are organized to be integrated into each one of those programs through our program goals, several national centers, and our grant programs. Next, please. And here you see just the cute little movement. They all interact, and the cross-cutters for all of them are family-centered care and cultural and linguistic competence. So in 2000, in the year 2000, we launched the first of our strategic plans, and it was called, that previous slide, it was called the 2010 Express. And we launched it on Child Health Day in 2001. And Vaughn, I don't know if you can get the noise from that little slide, but it's a train noise. And we celebrated that for 10 years. And in 2010, next slide please, we then launched a new campaign called Envision 2020. But for a moment, before I turn it over to Diana, I want to talk just a little bit about how far we've come since that first agenda in 2000, and that we really should be celebrating where we've been. So I'm not going to read each one of these to you, but just to give you a flavor of where we've been with each of those 6 systems indicators. For example, for the Family Professional Partnership, we now have principles and definitions in place of family professional partnerships and family-centered care. We have measurement strategies that have been developed and implemented. We have strategies and tools for improvement through some of the work that's been done by Family Voices and other family organizations. And we have a strong evidence base emerging. Next slide. For the medical home, gee, if you haven't heard the term medical home, I don't know where you've been, but this was a term that back in 2000 people were just rolling their eyes at. And we were pretty much, us and family partners and the Title V programs were pretty much the ones that were touting medical home as an indicator of quality care, and in fact the main indicator of quality care. But since that time, over the last decade, we now have a joint policy statement from Family Medicine and AAP and other organizations. We are closely linked with continuous quality improvement movement. Medical home has been expanded to adults as well as children, and in fact some would say in the adult world, medical home, health home has sort of outrun the pediatric community. We've had demonstration programs in almost every state. Health plans in the private sector are now leading the way, and health and medical homes are the central component of the Affordable Care Act. Next slide. Early and continuous screening. Again, massive progress here. Many of you may have noticed the huge movement toward universal screening for autism, and that's one of the primary screeners that has gotten a lot of attention lately. But there's also a huge increase in the number of children who have gotten developmental screenings and behavioral screenings in their medical home. And of course, the Bright Futures guidelines now integrate children and youth with special health care needs into the broader guidelines for all children. And that Bright Futures guidelines document has significant emphasis on screening. Services organized for easy use. This is a tough one. We've worked very, very hard in this area. And over the years, over the past decade, we've been able to demonstrate community models of service delivery to make sure that services are organized for easy use. There's plenty of models outside of MCHB, though. The Social Security Administration's money follows the person model of systems change has shown great promise in organizing services for easy use. And then, of course, the continuing emphasis on making communities accessible and inclusive. And finally, transition to adult health care. There's a growing recognition of the importance of health care transition for youth. And over the past 10 years, we've seen a consensus statement on healthcare transitions for young adults. That was in 2002. Then in 2012, the AAP published its statement supporting the healthcare transition from adolescence to adulthood in the medical home. There are youth advisory councils in almost every state and at the national and state level. and there are many emerging innovative models of care for youth with special health care needs. So at this point, just having given you a flavor of where we've been in 10 years, I'm going to turn it over to Diana to talk about where we stand and provide the lead-in for the current review on the Healthy People 2020 objectives.
Thanks,
Diana.
Bonnie. So Bonnie gave us an excellent overview of some of the history of where we've been and where we are now. And so we need to get a look at, okay, where do we stand? We know we've accomplished some things, but where do we need to go? And if we look at the National Survey for Children with Special Health Care Needs, we know that we've had some progress, but if we look at the overall progress around medical home, insurance and financing, and transition, it appears as though there is no overall progress nationally. Other indicators we have changed a bit so that they're not comparable, and that's because we needed to strengthen some of the indicators that we were looking at so that we could actually capture a picture of what it was we really wanted to take a look at. What we do know is that children with special health care needs, particularly those with significant ones, continue to far less well than those with less significant needs. I think that might be obvious. That disparities still exist based upon poverty, race, and ethnicity. In other words, people of a minority race may not feel as though they have the same extent of family professional partnerships as those of a minority race. We also need to identify and focus again on changing some of those components of each indicator so that we can more accurately measure success rates and increase those success rates. So when we look at where we stand now, we started to think about strategic planning. And the title of what we've been doing is Envision 2020. And, you know, I really like that because to me Envision means, you know, you visualize, you imagine. You conceive something as a possibility, especially in the future. And some people even want to say to a bright future. So that's what we are envisioning in our strategic plan. If you look at what our plan is based upon, it's based upon what we're trying to accomplish across 4 different levels of health care. Up at the top is the direct services where you have, you know, actual health services directed to the patient and family. Next to that, enabling services where you help with the access of those services and support. Population-based services, your prevention, your promotion, that kind of thing. And at the base, where all of this rests upon, is infrastructure. It's the foundation of all of the above levels. And you see we serve families of all kinds, all races, all nationalities. Next, please. Well, when we started thinking about our strategic plan, we wanted to build on the success of what we've been doing for the last 10 years. And Bonnie talked about our 6 core constructs, and, you know, there's a relation to Healthy People 2020. But as we're looking into the future, as we are imagining the future, what would those systems constructs look like in 10 years? Can we make them better? Do they need to be the same? And what is in place for us to improve upon those core outcomes and the systems? In other words, do we need other supports out there? What can we as partners do to influence or make a significant move forward? And it may be that we take a look at, you know, our partnerships as well. So when we're thinking about 10 years from now, we're also looking at emerging trends and issues that have come into the health field and should be addressed for our systems. With life course, you know, there are critical stages and events that happen across a lifespan from prenatally on up that can impact the health and well-being of someone. So we need to look at that, and some of that is influenced by social determinants and poverty, that kind of thing. With healthcare reform, you know that's very important. It's coming up now with the Patient Protection and Affordable Care Act. Is that going to help us? Will that make our core outcome for insurance better? What about quality improvement? How do we ensure that we are making progress and looking at those steps of change towards improvement? Cultural competence with the changing demographics. We really need to look at strategies to embrace everyone's culture within the healthcare system. And health information technology, you know, looking at the electronic health records, how are they going to be family-centered? How do we use telehealth and telemedicine to increase our outreach and access to services? So when we're looking at all of the things that we need to consider to maximize success in our strategic plan, you know, is what we're thinking about relevant? Is it relevant to the systems, outcomes? Is it relevant to our population? Or what we're listing as directions in which we want to go, compatible with each other within a performance measure or a core outcome? Or is what we're proposing, is it feasible? Will it have regional and national significance and not be relegated to just, you know, a locale? And we're looking for outcomes and potential impact. We have to have a way to measure what we're doing so that we can show that what we are doing works and we can justify funding. And how is what we're doing out there in the communities and at the state level going to be sustained? You can't have a grant, you know, for 20 years. So what are the different mechanisms we can use, like partnerships? So that's where we have come up with our glorious Envision 2020 strategic planning document. It will be out there soon. There are 3 sections to it, and you know, you can look that up or ask me about it, but I think I'm running out of time. And then you have our contact information. With that, we're going to transition from the background here on up to how is all of this relevant to Healthy People 2020, and how do we protect that family perspective?
Thank you, Bonnie and Diana. I will put their contact information back up at the end with the contact for myself and Trish as well, in case people have more questions. So thank you for that background. That was a perfect introduction to what Trish and I will be talking about, which is this consumer perspective document that we all work together to produce. The document is split into 4 chapters, and chapter 1 is a lot of what was covered by Bonnie and Diana, the history and the overview of healthy people, of children and youth with special health care needs, and really why we felt this consumer document is so important is because, you know, more than 20% of U.S. households have at least one child with special needs. So from that, we really wanted to be able to show the family side to complement what was coming from agencies like MCHB and others. So the document, as I mentioned, is split into 4 chapters. Chapter 2 will be the focus and the bulk of what Trish and I talk about today. It focuses on objectives related to the 6 MCHB performance measures that Bonnie went over. And so how did we get to the objectives that we actually focused on for this document? You know, we started with the approximately 600 objectives that are in Healthy People 2020. Narrowed those down to about 100 that are related to children and youth with special health care needs, and then cut that again to really focus on the ones that are most relevant to the MCHB measures. So if you download the document, you'll see that it's split up by measures, and we have here the objectives that we think are relevant, particularly relevant to each measure. Just a quick note, you'll see the bottom one here has an asterisk next to it. Objectives in Healthy People 2020 are either measurable or developmental. The measurable objectives all have an established data source, such as the National Survey of Children with Special Health Care Needs. Each of those measurable objectives also has a baseline value from a previous year, which is used to set the target goal for 2020, whereas the developmental objectives don't have that baseline data point, but they do have the nationally representative data source that can provide that data for the future. So as we go through the slides with the objectives on them, that means that's what the asterisk means. You can see that these objectives that we've put in here for Measure 1 focus on decision-making, communication, and support. So Trish and I will be presenting the objectives for each measure and then some highlights and takeaway points for each one that really became clear to us as we were researching and writing. And kind of a summary for this Measure 1 was that family-centered care is based on the recognition that children live within the context of families, and that families are the ultimate decision makers for their children. And that's why it's so important that families participate in decision making about the children's health. Because really parents and families, as I'm sure many people on the line know, are the experts. They're the ones that are caring for their children every day. They know the ins and outs of the healthcare as well as the non-medical services that their children are using. But it really wasn't until the 1980s that families really became an influential presence in national decision making. So our own organizations, Genetic Alliance and Family Voices, were really the products of this kind of rise of the parent movement. And today there are thousands of support and advocacy organizations for specific conditions as well as general patient and family advocacy. And so these groups now are having a much bigger role in decision making kind of at the national policy level, and then trying to make sure that translates into the kind of everyday level of families working with the healthcare provider teams. Second takeaway for this measure was really about cultural competency and language appropriateness, that unfortunately it is often the already underserved groups that do not achieve these performance measures, and lack of a sense of partnership has been correlated with lower income, no insurance, but also language other than English spoken at home, and racial ethnic minorities. So making sure that healthcare is culturally and linguistically competent is essential for true partnership. And then finally, that children themselves must partner as they come of age. It's not just about the parents and family. And Trish will talk about that once we get to Measure 6 regarding transition. Bringing us to Measure 2, focused on a medical home. And these objectives really relate to wellness and preventive measures, as you can see here. And we have more objectives related to this measure, and you'll see that these are developmental measures that really focus on hemoglobinopathies and sickle cell. And one of our overall takeaway points for Healthy People 2020 in this document was the new topic areas that focus on specific conditions. Blood disorders and blood safety was a new topic area for Healthy People 2020. Genomics was another new topic area, and that these were particularly relevant because MCHB has the programs focused on thalassemia, hemoglobinopathy, sickle cell, etc. So our highlights for Measure 2 is that a medical home is not a location. It is an approach to care that's centered on the partnership between family and providers of all services. So kind of building on that family professional partnership from Measure 1 is this medical home measure. So Diana mentioned the disparities that still exist even after a couple decades of these healthy people documents. But in addition to disparities between children with special needs and children without special health care needs, disparities exist within the special health care needs community. So children with disabilities affecting their functional ability, their ability to complete the activities of daily living, are less likely to receive care in a medical home compared to children whose functional abilities are not affected by their condition. Similarly, children living in poverty or rural areas are also less likely to receive their care in a medical home. Again, mentioning the blood disorders and blood safety topic, it's a big deal for these new topic areas to be included in Healthy People 2020 because it really puts the conditions on the national public health agenda. These objectives in particular came to be out of a meeting in 2006 of the National Heart, Lung, and Blood Institute along with MCHB, CDC, and other organizations where they developed these objectives that would be included in Healthy People 2020 to really try and achieve comprehensive systems of services across the lifespan for individuals with these blood and clotting disorders. And then finally, a note on continuity of care that we saw throughout the objectives, throughout the Healthy People 2020 document, the lack of continuity of care, that there are gaps from the pediatric services to the adult services, and we'll see this again when Trish talks about Measure 4 about screening. Moving on to Measure 3, families of children with special health care needs have adequate health insurance and financing to pay for needed services. And you'll see that there are just two objectives here. And this really was our takeaway for this measure. We have here that more than a third of insured children with special health care needs have inadequate coverage. So even though they do have insurance, the insurance is not covering the services they needed or the cost of those services. And that was an important point for us looking at the insurance objectives was one, that there are very few objectives related to insurance in general and none specifically related to children and youth with special health care needs. We realized that it will be important to include objectives that facilitate access to care. So simply having insurance does not make you healthy. But if you become unhealthy or have special health care needs, you need adequate insurance. It's critical to improving or maintaining your health. So even though it's not, these objectives are not related to direct clinical care, it's still important to include these objectives that facilitate better health care. Again, health insurance cannot provide the full range of services that children and youth with special health care needs rely on, so it will be necessary to find other ways to pay for those activities and services that promote quality of life and create the social and physical environments that promote good health. So there are several states now that are looking into and developing new strategies to fund services that are not typically covered by health insurance, care coordination, different relief and trust funds, et cetera, will cover a range of non-reimbursable health-related expenses. And then finally, Diana mentioned the health reform, the Affordable Care Act. With the passage of ACA, healthcare is expanding and hopefully closing the gaps that we're seeing. There are negatives that we've mentioned. There's still disparities that exist, but there are also some positives. I just saw an article from April in the American Journal of Public Health that was looking at the 2003 and 2007 national surveys of children's health, and they showed that while children with special health care needs fared worse than those without special needs with respect to physical activity, obesity, household tobacco exposure, and emergency department visits, they actually fared better on currently having insurance as well as having a personal health care provider. So while the disparities exist, hopefully those gaps are closing. And with that, I will turn it over to Trish to go over the remaining 3 measures.
And the fourth measure has the most
focus objectives, which are 13. And so I'm not going to read through them, but I'm just going to let, there they go, the whole total, and how the importance of looking at having early and continuous screening. Again, I think we've all touched on some of those, and it's helping with early identification and getting services to these kids. But unfortunately, which is currently described looking at the early identification as screen it and leave it, because there is little follow-up, and it's an issue that has been detected, and it's really not acceptable. And we really need to work together on getting information out and finding those providers to provide those services to our children. Some of the other major highlights were having more objectives than any other category. Well, I mentioned that earlier, it has more objectives than any other category. The lack of emphasis on continuous screening, many of the objectives related to newborns and children, but few addressed adolescents or early adult, young adulthood objectives. The evidence-based screenings help prevent disease, promote health, and empower children, youth, and families, which is all what we're looking at right now. And there's a lot of studies out there that are moving this forward, as well as other agencies. But we need families, again, to be involved in continuously helping our professionals looking at these objectives and moving them forward. Next slide, please. Major 5, community-based services are organized and easy to use. Again, there's not, there was a lot on this as well, and we're looking at, again, looking at with the new one that always caught my attention was working with, again, pulling in tribal nations now and working with them, especially with the Title V block grant. But we looked at coordinated barrier-free design is essential to make this happen, the use of community services that are easy to use, and this really cannot be accomplished without the cooperation of many stakeholders, and families and youth need to be included in helping move this forward. Again, the highlights looked at the availability versus access. Stakeholder cooperation was needed to improve services that are fragmented by so many funding systems. Community brokers need to help facilitate those connections, and those are individuals that exist within various communities to help get your foot in the door, and it's very important, especially with communities such as tribal nations or immigrants, migrant populations. It's very important to network with those community brokers in order to help you make those connections where they need to be made. A shared goal for all the service providers should be what you need, when you need it, or nothing about us without us, is another saying. Thank you. Could you move to the next slide? Again, I'm going kind of fast because of our time. Youth and youth with special health care and receive the services necessary to transition to adult health care. This has been, again, kind of a hard one because there's not a lot of providers out there who are willing sometimes to take on our children, or we just don't have the providers in the rural communities or in other areas that can really take on our children with special health care needs. And so it's been an ultimate outcome for MCHB and the performance measures that fewer than half of the pediatricians are providing transition support services, and really few initiate the transition planning early. And I have to say that it's so important to look at transition very early on and get involved in finding out who can your children transition to, and networking with, again, those partnerships to make sure that this happens. Because there is a lack of provider capacity to serve our young adults in transition. And the transition from pediatric to adult to adult health care, again, I stress needs to start early, and states are now beginning to include youth in the planning and development and transition, which is, again, very important because they're the ones saying nothing about us without us, because they live the experience, and we really need to start pulling in those youth very early on so they can help guide in the development of the plans that involve them. Next slide, please. One thing I wanted to add to that all of these really deal with building and strengthening those family professional partnerships, but also we need to look at the youth as being part of those partnerships and the importance of infusing the cultural and linguistic competency in these various areas, because a lot of the needs that are out there with the studies, numerous studies done across the various divisions, show that a lot of the health disparities are within areas of, rural and frontier, a lot of people of color, Indian tribes, African Americans. We have high rates of special health care needs within those populations, so the importance of the infusion of cultural and linguistic competence throughout whatever we do is very, very important in order to help move this whole initiative forward. And now I'm going to turn it back over to Vaughn.
Thank you, Trish. I will just give a little summary of the rest of the document, but give all of our attendees a reminder that if you have any questions, please use the control panel on the side of your screen to type them in, and in a couple minutes we will get to answer any questions that you have. So Trish, that was a perfect addition. Thank you for adding that, because that should definitely be a bullet on this takeaways slide, was about the cultural competence and how important that is. And just because the services exist does not mean that they are easy to access. And so some of our big takeaways from putting this document together was really that the Healthy People 2020 objectives are more focused on adults than children, and adding to that there's little continuity across the life stages. As I mentioned, there was a special meeting in 2006 to develop those blood disorders and blood safety objectives, and there were similar development processes by different agencies and different groups to develop all the objectives. And so since they were developed independently of each other, there's not a whole lot of flow. So there are a ton of screening objectives, which is great. There's screening objectives for children, and then there's screening objectives for adults. But where are the screening objectives for adolescents and young adults to make sure that the document is really focusing on every stage of the lifespan? Another takeaway was the focus on specific conditions. Again, BDBS was the new topic area, but there were several new topic areas for Healthy People 2020. And that was really the summary, the long version of the summary of Chapter 2 of our document, but we did finish it up with 2 chapters on at-risk populations and how Healthy People 2020 can influence health as individuals age and have access to different systems. So Chapter 3 of the document looks at the continuum of risk from healthy kids with no special health care needs to kids with chronic conditions but who still don't really have the need for extra services, to kids who have chronic conditions and special health care needs. And we talk about the different risk factors across the continuum, including social determinants of health, and also how there needs to be a more clear definition for the at-risk portion of the children and youth with special health care needs definition. Because it's defined as those who have or are at risk for a chronic physical, developmental, behavioral, or emotional condition, and who also require those related services, but that at-risk portion has not been clearly defined and could use a little more clarification. And finally, Chapter 4 of the document emphasizes the need for that continuum of care that we've been mentioning, including screening from infancy through the elderly period. And we talk about the life course approach, which is that lifelong focus on prevention will ultimately lead to healthier individuals, families, and communities, as well as a healthier healthcare system overall. So a few decades ago, when children with life-threatening diagnoses, when few children with life-threatening diagnoses lived to be 18, talking about the future seemed unrealistic. But today we have to ask whether the future of children who happen to have special health care needs is enhanced by the current system of federal, state, and community supports, and how those supports can be strengthened and how we can grow them to meet all the needs of this population. So Healthy People 2020 fortunately gives us a starting place to answer these questions, but as I think we've highlighted today, there are still gaps remaining that hopefully all of us on the line can work together to try and address. So even though we got off to a late start, we still have several minutes for questions. So please type those in. I will read them out and ask also Bonnie and Diana to chime in if you have any other takeaways or final thoughts that you'd like to share.
Right. Well, Vaughn, can you hear me?
Yes.
Good. So I'm not talking to the mute button. So thank you for for that, Vaughn and Trish. I think that was enlightening in some ways, and I certainly totally agree with the takeaway messages. I think just to recap, you know, we're delighted that in just a decade we've really been able to up the visibility of children with special health care needs and the systems, the indicators of a quality system. But as you pointed out, they are not yet aligned well enough to tell a story. I remember as we went through the process of pulling these together, it became pretty apparent that some of the areas are far heavier than others, and we were very, very surprised to see so little emphasis around adequate financing for children with special health care needs, and not surprised, but still hoping for more around the issues of family professional partnership and shared decision making. So this was really our first look at how do the Healthy People objectives align and tell a story about children with special health care needs. And I think, as Vaughn has pointed out, what we learned is that we really have to do some work in this area. I think there is a story to be told, but I think we have a lot of issues to address in order to tell that broad but rich, very rich story from the Healthy People 2020 objectives.
Thank you, Bonnie. And talking about building the story and the narrative just reminds me that we did include several individual and family stories in the document that really, I think, give a lot of character to, you know, some of the drier listing of the measurable objectives. So please do download the document. If you have not done that yet, up on your screen right now is where you can find it on the Genetic Alliance website. It's geneticalliance.org/healthypeople. And I've also put up the websites here of our partners on the line, Family Voices, and the Division for Children with Special Health Needs, as well as the MCH Library has a knowledge path on children and youth with special health care needs. This webinar recording will be available in about a week. Everyone on the call today will receive an email from us with the link to that archive, and then you can feel free to share that with anyone else you think might be interested. I know that the presentation as well as the document are also up on the Family Voices website. Go ahead, Trish.
I wanted to add another resource that's important that sometimes is left out is the military families, and we have a link to the Military Families Children with Special Health Care Needs link on our website. So if you have military families or bases in your state, they're also looking at partnering, and that's a great website as a resource for those families and how to network and find where they are.
Great, thank you. We did have a question that I think I will direct to Bonnie and Diana about how to get involved if you are interested in being part of the development of objectives for, I guess, Healthy People 2030 and on down the line. How can people do that?
Well, this is Bonnie. The Healthy People 2030 has, to my knowledge, not yet begun. But if you will send me an email, there's an individual here on our staff who leads the Health Resources and Services Administration component of the Healthy People 2020 objectives, and that she will be able to give you input on the current objectives, because we measure those periodically as we go through the decade, and then when the 2030 planning begins, you will be added to that list.
Right.
Email.
This is Diana. I think, too, if you're interested in working around activities in your state around 2020, you can also contact us, and we will refer you to a family leader in your state, perhaps a children with special health care needs staff person as well.
Great, thank you. We've had a couple more questions about just the logistics of the presentations. The audio will be available as well as the PowerPoint presentation. That's what will go out to everyone in a week. So if you have colleagues who missed the presentation, they will be able to check to listen to the whole thing. Hopefully we did a good job of consolidating a long document into just these few highlights here. We had a note that there will be a transitions conference in Houston hosted by Baylor College of Medicine in October, the 16th through the 18th. Families, health providers, legislators are all invited, so I assume that you can check that out on the Baylor College of Medicine website if you'd like. Since that information was provided, I'll go ahead and do a selfish plug. If anyone else has any other conferences or other information similar that they think would be of interest to this broad community, please go ahead and email me, vedelson@geneticalliance.org. I put together the Genetic Alliance Weekly Bulletin. If you're not on that list, you should subscribe. We send it out every Tuesday, and that includes conferences, calls for abstracts, new articles, other resources and highlights from the genetic health and advocacy community. Trish, the military website that you mentioned, I know that link is on the Family Voices website, but where exactly can they find that information?
Okay, the link is www.militaryfamily.org.
Military family singular?
Yes, it one.
Great. Thank
and then
you.
You can click on children with special health care needs. And I'll put in a shameless plug for our Family Voices newsletter as well. We provide, again, information and resources on what is available, what's new. We have a lot that's happening with various conferences and resources regarding ACA, and that's Friday's Child, and you can link on, get on our website and subscribe, and it's a electronic newsletter.
Great. Yes, everyone should be on that list as well. If there are no other questions, we will go ahead and wrap up. Thank you all for bearing with us through our technical difficulties in the beginning of the webinar, but I hope that you enjoyed the presentations today. This really, the document itself, as well as this webinar, were really meant to be a launching point for discussion to help identify gaps that exist and be able to work together moving forward, you know, as we approach 2020 to be able to make a difference in some of these objectives and really move the bar. So please, I think all four of us who are on the line today, encourage questions and discussion. Our email addresses and phone numbers are here, and we would love to hear from you about how to work together to make some change moving forward. So I hope everyone has a great day, and you'll be receiving an email with the recording in about a week. Thank you all.
Thank you.
Thank you.